Thank you for tuning in. So again, we are having this town hall here so that I can introduce some people. First off, I want to introduce Jason, Amy, Jay, and Samantha Hilson. She is the Director of the Health Promotion at the Tompkins County Health Department. Today, Tompkins County and the Southern Tier region, we move into phase 4 of the reopening. I know everybody's been kind of waiting for this to happen. It means that some of the low-risk arts and entertainment industries will be allowed to reopen. That includes some museums, gardens, art galleries, and some agricultural tourism. It also allows for gatherings up to 50 people, so that's up now from 25. And houses of worship, my own church, for example, they can increase capacity up to 33%. So all pretty welcome changes and hard-fought changes, frankly. This coronavirus, it is not over. We see some states across the country, they're reporting just staggering increases right now in the number of positive cases. Some of these states are actually pulling back just a little bit. Texas, you may have heard, has pulled back a little bit. Florida has pulled back. They're not going to be serving alcohol in bars anymore down there. And Texas has actually moved back to restricting the numbers again in bars. New York, we've been able to curb the spread, and that's because we've been vigilant about it. We've seen one positive case can infect just a lot of people, right? You get one person, and then you get a spreader event, and that can affect a lot of people. And that's what we're really trying to guard against. The best way to keep people safe right now and from getting sick is, wearing a mask is obviously a good thing. If you can't keep that 6-foot distance, a mask is a great way. It protects you, it protects other people. But again, keeping distance, it's not that hard. A lot of you were probably keeping distance even before this happened. So here you go. This is one thing you can do. That's 6 feet. And again, wash your hands regularly. I mean, I think everybody kind of knew that beforehand, but even in flu season, that's always the rule, right? Wash your hands regularly, wipe down things. It's the simple things that really can keep you safe. So we've seen other crises arise from COVID-19. Our local economy is being impacted. And while businesses are adapting, many are still struggling. I'd encourage you to find ways to shop locally. I mean, the stores are open. Wearing a mask too. I mean, I go to Lowe's a lot. I mean, obviously my house is much better now than before the quarantine. I've been going to Lowe's. Pretty much everybody I see, or Home Depot, sorry, equal opportunity shopper, but pretty much everybody I see has a mask on. It's pretty rare. Although I was down in part of the Southern Tier in another area today, gas station, a lot of people weren't wearing masks. So you're going to see that. You're going to see people getting comfortable. And, as long, again, it's you have to judge the safety level too and what you're comfortable with. As people start getting more comfortable, they're going to stop wearing masks. And then you have to walk into the store and say, am I comfortable with this situation? If not, don't go inside. The county, we're responding to the ongoing crisis of racial inequality that's been with us, frankly, for decades. And it's really become very apparent in these past few months. All that's been brought to light, frankly, following the killing of George Floyd. The county, we are instituting an equity and anti-racism strategy. We already had one in place, but obviously, we are going to adapt to this as well. And if there's areas that we need to ramp up on this issue, then we certainly are open to doing that. All of our operation, frankly, is kind of centered around this. And we've been taking on this challenge for that too, for decades, and just something that we are very mindful of. I'm going to let Jason share more on that plan in his update. Many of us are wondering how our local colleges are planning for reopening and when they bring the students back in the fall. How can they make sure that everybody here is safe, and how, frankly, we make the students safe as well? Because again, it only takes one person, and then you have a spreader event. We don't want to put anybody at risk of COVID-19 at all. We don't want to personally put anybody at risk at that from a county standpoint. I'm going to invite Jason Molino, the county administrator, to go more into detail on how the colleges are making plans, because they are definitely out there. There's a lot to it. So, and how that county and the health department and the hospital are all going to be working very closely with the colleges at their reopening. So with that, I'm going to leave it to Jason Molino. Jason.
Thank you, Mike. Thanks for joining us today. I introduced everyone, but I always like to say that everyone's always excited to see their favorite department head, Jay Franklin, the Director of Assessment, on board. So Jay, good to see you. And Sam, thank you so much for filling in for Frank today. Mike, just to pick up where you left off, talking about higher ed, higher institutions. Major part of our community, probably our number one industry is education. And we have continually for the past, well, really since the onset of this, it actually started, our original communication started with a great collaboration with higher ed back in mid-January, and has continued all the way through. We meet regularly with higher ed weekly. I know Frank in the public health department meets at least several times a week, and we have been helping them and providing guidance and assisting them in preparing their reopen and reactivation plans, and consistent with New York State guidance as well as the CDC's guidance. And they've been exceptional to work with. They're taking their roles in the community very seriously. They want to ensure that their students, their faculty, the staff, and the community themselves are protected and safe as they talk about reopening and bringing students back this fall. And that's an important part. It's an important part of our economy as well. So we continue to work with them. We will continue to work with them through the summer, through the fall, as long as we have to, with respect to this virus, and continuing to be open and communicating with them and supporting them. So I want to give them a good hats off and give them a lot of credit for the hard work that they've done and they will continue to do in the near future. We continue to see a decrease in the number of cases, and people have been following the guidance. Like you said, Mike, I agree with you. A lot of people wearing masks when they're out, a lot of people keeping their distances. And it has the direct impact of stopping and really slowing the spread of the disease. And a test of that is, some of the states aren't as fortunate as we are right now. What we went through between March and April, and what some states may be facing, unfortunately. But our due diligence, the state's due diligence, and I think the community deserves a thanks and a pat on the back for an excellent job of making this happen. Again, a big shout out to our folks at the Public Health Department. Done an exceptional job running through the contact investigations, which is the contact tracing, communicating with people, providing good guidance. That includes our public health nurses. It includes the whole team. Environmental health has done an excellent job as of recent with the reopening and answering a lot of questions being available for folks, as well as the reopening. Reopening of the economy is one thing, but also there's other duties that go on that ensure that folks can continue to build, continue to construct. Environmental health has an important role in that. So we thank you so much for that and the ongoing work that they're doing, as well as the preparation for potential disease spikes. We're in a position to build off of the successes that we've had over the past few months. Definitely learned a lot in the past, and we're going to be able to apply our knowledge and what we've learned as we move forward, to minimize any increases in spikes that we may see, but also to be able to combat anything that may we encounter. You might mention, Mike, our discussion about an equity and anti-racism strategy and agenda. This is something that the county has worked on a lot in decades past. Nonetheless, there is a lot of work to do, and say that it's an ongoing effort to continue to try to combat systemic racism and inequities in our organization as an employer and as a service provider. Both very important elements of what we do. This year, Mike, you and the legislature did adopt and approved the funding of a chief equity and diversity officer. And we were about to advertise and post that position right at the end of February when everything ramped up for COVID. And we had to press the pause button on a lot of things over the past several months. But I'm happy to say that this week we did post the chief equity and diversity officer position. It's a position that is going to be important to help support our efforts as in the county, both as an employer, again, and as a service provider, as we start to identify some of these barriers and continue to make our workforce and our organization a better place to work. Looking for good leadership, good collaboration with that person to come into that role to help us, not only in the immediate future, which would be with some possible law enforcement reforms, but also as we continue to improve ourselves as an organization. On that note as well, I just want to mention, since I have the floor here, that our Tompkins County Office of Human Rights is starting a panel series next week with critical questions and discussions around race and equity in terms of a public forum. Next week's kickoff panel also intersects with Pride Month, which is the month of June, and is on Black and White LGBTQ plus collaborations, and it will feature two of our other county legislators, Shauna Black as well as Ann Corman. So stay tuned for more opportunities for more community-wide dialogue on these issues, as well as others. So talked about Jay Franklin on board with us today. Amy Hendricks, our Deputy County Administrator, has been in charge of the incident down in the Emergency Operations Center. Sam is our Director of Public Health. Thanks for filling in. I'm sorry, Director of Public Health Education, not Public Health. Franca is off today. So thanks for joining us. Mike, I'm going to shoot it back to you and start with some of the questions.
Hey there.
You're good.
Oh, okay. Jason, I didn't print out that page. Let me take a look here at the questions. So give me 2 seconds. Questions. All right. So SAM testing and tracing, as more people come down or come to town, how do we know they are staying the course?
Good question. Thanks, Mike. So we'll be continuing to monitor cases as we've done throughout COVID and throughout the past couple of months through testing and contact tracing that the nurses at the health department conduct. So as we move forward, there are likely to be more cases as people increase travel and come to our community from other places. And so it'll really take the work of all of us to continue to slow the spread by wearing face coverings. The frequent hand washing continues to be really important. And of course, maintaining that 6 feet of distance when you can.
All right. The next question is Amy, I think, is going to ask that one.
All right, Mike. I think the question is for me actually on the
Oh, okay.
operating.
All right. I'm sorry. I did not read this carefully enough. Let me get to it. 1 second.
All right.
All right. So Amy, the county has been operating the Emergency Operations Center for over 3 months now. What is the current status of the EOC?
Sure. It's all right. The current status of the Emergency Operations Center is that you can notice that we're in different offices. We are still operating the EOC. However, we have moved off-site for some of the time during the week. We'll continue to operate the EOC as long as there's still a pandemic. And so there's still a lot of things that are happening and we're just all working together on them. So we're remote, but still working together and still coming together a couple times a week to provide whatever assistance we can.
Because we're still under a state of emergency, right?
We are still under both a New York State as well as a Tompkins County state of emergency.
Okay. All right, Amy, thank you very much. Sam, the next question is for you. It's what is the most recent travel guidance and when do I have to quarantine if I travel out of state?
Yeah, so this week, New York State did announce that travelers entering New York who have recently been to states that have been identified with significant community spread are required to self-quarantine for 14 days when they come back to New York, New Jersey, or Connecticut. So the identified states, these affected states will be updated on the New York State Department of Health website at least weekly because we do expect this to change, that the rate of disease will go up and down. So we are awaiting additional guidance from the state about this travel advisory and the quarantine restrictions. But overall, state travelers really need to follow the steps that we've all been taking here in Tompkins County. So again, wearing a mask, staying 6 feet apart, and self-monitoring your symptoms. And travelers should be doing the same, whether or not they're here for 14 days, for that full 14 days. And if somebody does get sick and has symptoms that relate to COVID, then they should seek testing and stay away from others until they get that result back. So we do continue to get notifications about international travelers, which we have all along. And our health department nurses are contacting those individuals and put them into precautionary quarantine for the 14 days from departure from that affected country. And again, monitoring daily their symptoms. So again, we'll see what happens as things progress with the domestic travel advisory.
I mean, this is being touted kind of as a new I'm sorry if I take you off guard here, but this is being touted as almost like a new policy. But frankly, this sounds an awful lot like what we were kind of doing 2 months ago when people were coming from hotspots and stuff, that people were being recommended to self-quarantine.
Yeah, that's true. And, and it's also been a recommendation that if travel is not essential, that you should try and stay home.
Yeah. I mean, we only, people bring this up all the time too. We only have one active positive case in Tompkins County. I mean, does that mean that we're more safe now? What does that mean?
Yeah, that's a good question. We've been really happy to see those numbers of positive cases continue to decrease, and our positive cases have recovered. So that's really good news. And kudos to the whole county for doing that work and following the guidance to slow the spread of COVID. So even with these low numbers, though, we don't want to become complacent, and we want to continue to take those precautions that I've already mentioned, like wearing masks and paying attention to density when you're out, that more people can gather, that more things are open, which is great, but also you want to be thinking about how many people you'll be around when you're out in public. The virus is definitely still present, and we're seeing this around the country, as you mentioned, Mike, and so we still have work to do. As I mentioned, the state guidance has relaxed a bit on the size of gatherings. It's gone from 25 to 50 people now, but it's really still best to stick with your household and the members of whatever party you're in when you go out.
All right, thank you very much. Jay, the next question is for you. How, as more people return to work, is there going to be an increased access to childcare?
Thanks, Mike. There's more daycares that are continuing to open, and we do have some summer day camps that are going to open as well. Just today, they released new guidance about those day camps that increase the size from 10 to 15 children that could be served within that pod. And as this information is constantly changing, one thing that I always recommend, we have a great resource out there in the community. If anyone's looking for childcare, to give the Child Development Council a call, and they're constantly looking at who has vacancies within the childcare centers and be able to offer some guidance. In addition, we're also waiting for guidance on our K-12 and what's going to happen this September. We're in regular contact with the school districts and BOCES, and I know they're constantly looking at different active scenarios. So stay tuned. Hopefully we'll get some more guidance out on that from them and from the state. So
that is the question I get the most right now, is the K through 12, Jay. I mean, have they given you any indication of when they're going to give some guidance? I mean, the start of school is like 10 weeks away.
Yeah, I would hope they would have something out by mid or early July. They're still waiting for some assistance from New York State as to really what they have to plan around and what will be allowed. But yeah, I know my wife is definitely looking forward to K through 12 coming back into place again as well.
Right. I mean, what's included in phase 4? We just start that today. I mean, what does that mean, arts and entertainment?
Yeah, so there are a lot of different things kind of fall under that umbrella. What doesn't fall under that are movie theaters, gyms, and indoor malls. They're taking a second look at that and seeing how the virus reacts in those kind of closed door situations where people may be sweating or eating and just kind of congregating like they do in malls. But there's different guidelines for low risk versus low risk indoor arts and entertainment versus low risk outdoor arts and entertainment. So I would definitely check the New York Forward website as different organizations are looking to see what they could apply. If you're outdoor, there's guidance where it's only 33% of the maximum occupancy. If you're indoors, it's 25%. So there's a lot of nuances between indoor and outdoor recreation. There was also guidance for higher ed. And as Jason mentioned earlier on this call, We meet frequently a couple times a week with our three higher education institutions and try to learn their plans as they're hoping for, I think, that early July announcement as well. I don't think it's too prevalent around here, but we also, media production is now allowed. And there are guidelines as well that New York State put forward on that New York Forward webpage. And I think the last thing that was added, religious ceremonies can now be increased from 25% up to 33% capacity. So we're slowly moving forward. I think the tortoise is going to win this race rather than the hare.
Has the state, I know that these things aren't included, gyms, indoor malls, and movie theaters, but has the state given you any indication as to when that's going to change?
I'll look to Jason, but I don't think we've heard anything on that. I know I'm looking forward because I never thought I'd be the person to say this, but I need to get back to the gym. That hour of sanity and quietness, I really miss that. But, we got to make do with what we have to do, and hopefully they'll get some good guidelines out there and make it safe for us to get back there.
Right. No, there's a good article, a letter to the editor in the Lansing Star actually today from someone who runs, it's not Frank Towner, but somebody who runs like the large organization of the YMCAs. And the picture he paints is actually pretty dire for that group of people. Don't really think of them as just a gym because they do so many other things, but they are a gym.
And that's a problem, I think, with a lot of different industries out there, or different property establishments, of where they would fit into multiple categories, and one may be open and one may not be open, and to try to figure out how they can operate in a safe manner and do it so that we're not spreading that virus. And that's definitely tough.
Okay. Are there any other updates today on county department operations?
Yeah, not much has changed from the last time we were on here. I would still recommend that if a person wants to go to a county office, to check out the webpage first. You may want to call just to see what protocols may be. Some doors may be locked. You may have to make an appointment. I'd like to point out that our DMV office is open, but it's by appointment only. So if you go to their website, they have a application. You can go there, schedule your appointment. We had a report the other day. Someone needed to get their license renewed. 8 minutes, they were in and out of their door, nice and happy. We have one of the best DMV offices here within the state. That's probably why people from all over the state come here. They know they're going to get in, get out, and be treated great.
All right. Thank you very much, Jay. I know we have some questions from Amy now, so I'll turn it over to her.
Thanks, Mike. All right. So I'm going to start this question about travel, and Sam, I'm going to ask you to help answer this one. Travel, what is permitted or advised, and how do travel and safety concerns, well, actually start with that one. Let's talk about travel. What is permitted or advised?
Yeah, so we mentioned before this new travel advisory for any travelers coming to New York State from the states that have been identified as having significant community spread. And so, if individuals from our community have plans to travel to those states or come back, they just should be aware of this new guidance that they'll have to quarantine for 14 days. And more information about all that is on our health department website and the New York State Department of Health website. So, and all along, we've also talked about how if travel is not essential, that's still really the case, that if you don't have to go far away from our county, then it's best to stay here. So that's pretty much it for travel. Mm-hmm.
All right, Sam. So I think the other side to this question is, for people that are traveling to our county, what should they be doing as they come in from other places? Is there any advice for them or advisory for them?
Yeah, so anyone coming into our county, it's important that they know what we've been working on here and following here, which is that we're keeping our distance from each other, at least 6 feet when we're in public, wearing masks or face coverings, hand washing is important, and monitoring our symptoms to make sure that if we are not feeling well, we're not going out in public, and if we need to get tested.
All right. Thank you, Sam. Jay, you touched on this a little bit with phase 4. As sports start to reopen on July 6th, how can teams play scrimmages? What's considered travel for sport and matches? Do you have advice around that?
Yeah, my main advice is to check the New York Forward website along with the Tompkins County Moving Forward website. There's nuances out there that it's very difficult to blanketly say this sport is available if you do X, Y, or Z. So they have the different sports broken up by low risk, moderate risk, and high risk. And depending on where your sport falls, soccer is a moderate risk. So you're able to have all types of play that would be available except for competitive tournaments. So they wouldn't want to see multiple teams coming from outside areas to one location playing multiple games. But I think you would be able to schedule a game locally kind of within our region. Higher risk, you wouldn't be able to do that with football, competitive dance, or cheer squads, of being able to hold those practices where you're interacting, touching, and kind of sweating on each other. But definitely when it comes up, go to the New York Forward website, Tompkins County's Moving Forward website. And we've done a great job with our website and being able to get that information out in a legible manner.
All right. Thank you, Jay. Jason, can you provide an update from the Summer Youth Planning Task Force about camps and what's happening this summer with summer camps?
Sure, I can. Updates are being made to the online camp guide found on our website to include camps and other summer programs that receive those updates. The task force members continue to share resources and collaborate to brainstorm creative programming for the summer that meets safety recommendations, which will be publicized via the camp guide and likely other means, probably social media and other social media contacts they have. Youth Services, our Youth Services looking into collaborations with community partners to help address some of the barriers that might prohibit local families from utilizing the resources highlighted in the camp guide and on social media. That's where they'll be highlighting them. So efforts are being made to try to not completely lose the season from camp opportunities, and hopefully more to follow with what opportunities are going to be open for folks for our youth and for our families to participate in.
And I think if any partners wanted to work with that task force, they should connect with Kate Shanks Booth, our Youth Services Director.
That is correct. Yep, absolutely.
Okay. Jason, I'm going to ask you about the gathering size. It's changed. We can now bring together 50 people. But what does that mean? Does that mean in-person get-togethers with people outside of my household? Does that mean wearing masks in those gatherings? What does 50 people mean?
So yes, it does mean still maintaining face coverings and as well as trying to maintain distances. That executive order and those directives still exist. And while there's a number that has been put out there, 50, I think we're still suggesting and encouraging folks to proceed with caution. Keep those face coverings available, keep them on you, and yes, you would be wearing them in those instances as well as trying to maintain distance. The whole purpose of this, while there's now a number that's there, I think it still doesn't undermine the foundation, the fundamental piece that wearing the mask, I'm wearing my mask to protect you, you're wearing your mask to protect me, keeping the distance is still a critically important piece of trying to minimize the spread of the virus. So while you can meet in those gatherings, it doesn't prohibit, it doesn't preclude or suggest otherwise that you shouldn't still have face coverings and still keep the distancing.
Thanks, Jason. On those face coverings, there has been discussion about the face covering executive order actually expires. Will it be extended, or has it been extended? And how does that work?
So while, as we've learned, we don't really get much forewarning about the extensions, renewals, or new executive orders that come out. I think it's fairly safe to say that while this one expires, I don't remember the exact date in July, but I think it's safe to say that this will be renewed and extended and will probably be with us for some time, if not in perpetuity in some form or fashion. I don't know, and I don't know that the numbers right now are going to have as much relevance as to whether or not face coverings are required as much as probably when the vaccine comes online and maybe becomes more accessible to the general public. So I think for now, it's safe to say that face coverings are going to be with us for at least the remainder of this year, probably longer. And irrespective of whether or not the executive order is continued, everyone has to assess their own risk and their own circumstances as to whether or not they want to take that risk, whether it's in public or however they go about their business. So I do think that it'll be renewed, and I think it'll be extended. And when it does, or as that information comes available, we'll continue to push that information out to the public as we have with everything else in the past.
All right, thank you, Jason. Sam, can you explain a little bit more about what this quarantine regulations means for people out of state? For instance, who regulates that? So if someone were coming from out of state, how is that regulated?
Yeah, that's a good question, Amy. And again, I think we're still awaiting some more state guidance on how this will play out. But for right now, again, if people are coming into our state and into our community from those affected states that have been identified by New York State, then we want to make sure that, again, they know that they are supposed to quarantine for 14 days and follow the precautions that we've been taking as a community. And so in terms of regulating that, it's a difficult question, but right now, while we're waiting for more guidance, complaints or reports can be given to the New York State pause complaint line, and the phone number and website. There's a website form also is available on our website, and environmental health at the health department or our community health services will follow up the best they can.
Thank you, Sam. On the same subject, what does quarantine actually mean? How do people self-quarantine? If they're coming to visit family as they travel in, how do they make a living arrangement? Should they stay away from their family they're coming to visit? Can you explain a little bit about what quarantine means?
Yeah, also a good question. That quarantine really means separating a healthy person, so it's somebody who doesn't have symptoms of COVID or any other illness, from other healthy people. And so, and the person who is healthy and is being quarantined, it's because it is thought that there was an exposure to a contagious disease like COVID. And so usually quarantine can happen in somebody's home. But again, if you're asking about somebody who's visiting, then that might be more difficult. So if someone is able to have their own bedroom and a bathroom that they can access, then it should be okay if they have a separate space. But any of these questions or specifics could be talked through with one of our community health nurses to make sure that they're in an appropriate setting.
All right, thank you, Sam. I think this question I will go and give to Jason on this. With such low case numbers, how do we communicate with the community so there isn't a false sense of security?
That's a really good question, because I think complacency is probably going to be, and it will be a big challenge for us as we move forward. Right now numbers are low. I think we have still just one person that's impacted that has not recovered yet from the virus in our community, which is great. That's not the case with just adjacent counties, and definitely not the case with adjacent states and as that ripples on. So I think one thing we have to continue to keep in mind is that New York is our boundaries around New York and the boundaries around the county don't really exist. It's a fluid and a transient environment. People are coming and going all across the country, all across the world, state to state, county to county. And we need to keep in mind that that's how the virus can be spread, and that we have to stay vigilant through those times until we start to have clear guidance from both the national and international levels that the virus has been able to be contained and that we have a different public health perspective. So how do you communicate? I think you just continue to communicate and push the message of the major actions we could take to prevent that spread. And to a certain extent, the fact that other states around us and other states in the country are seeing the opposite of what we are seeing right now is a very good reminder that, within a day's drive, we can be in a location that can be a very different landscape than what we're experiencing right now. It's because of our hard work. It's because of our diligence. It's because of everyone looking out for each other. We're in the place that we're in, but there are other states and other communities that are going through probably what we just went through 60 days ago. And reminding folks of that, keeping an eye on that, understanding that we're not isolated from that, and that we continue to push the good practices that we are. And again, a big part of this comes down to personal responsibility, right? Personal responsibility is probably the single most important thing that is going to prevent this virus from spreading. It's going to keep you and me and our families safe and healthy. And that's the biggest part of this. So personal responsibility, if we start to get lax personally on this approach, then we're going to see some negative impacts. So I think we continue to push the message. We continue to understand that we're not alone in this. And we've said that from day one. We're in this together, meaning all of us, not just in Tompkins County, just not in Southern Tier, New York State, Northeast region, but the whole country. And some folks right now are hurting. I did see a press release earlier that New York State is aiding and putting some support out to those states that are going through some tough times now. A reminder, stay vigilant, we'll be smart, and we'll get through it.
Thanks, Jason. I'm going to go ahead and ask, this one's actually for you, and Mike, feel free to chime in on this one. When will the county legislature start meeting in person with public allowed?
Oh.
Mike, you're on mute, buddy. You're still on mute.
Oh, all right.
There you go. There you go.
All right. No, I was just saying, if we did that, then I'd have to go downtown and, parking. Here, I can sit in my nice country house. But we're talking about July. So that's what we were talking about last time. I always try to keep 6 feet away from the other legislators anyway. So I don't think anything will actually change for me. But no, I think July, I mean, we already, the meetings are less than 50 people anyway. I think we can keep 6 feet from each other. So I'm hoping it happens sooner rather than later. I think it's important for us to do it. I mean, we're at phase 4. As far as I know, there isn't a phase 5. So this is pretty much it. The big hurdles facing, I think we've come to the big hurdle. It's kind of time for the county legislator to meet in person again. I'm certainly, I think GO will certainly be looking at that, and I'm hoping, we'll talk about it in-house too and see when we can do it. I'm hoping July. Frankly, I think that the big hurdle ahead of us is that K12 and what's going to happen. It's concerning that I haven't heard anything. I'm going to be calling two of my school board people today to see if they, I know people like to think that distance learning is a big success. I did not find it to be that. I hear of stories in certain school districts that, a good percentage of kids just stopped showing up. Once they called school, that was it. They didn't see those kids again. And that's not a success, if you ask me. So certainly, I don't know what the governor has in mind for that. And that's a big concern for me. But yeah, and I've gone on too long. The county legislature, though, yeah, certainly, I'm hoping we get together next month and start having in-person meetings. I make a much better case in person, so that'll be good.
Thanks, Mike.
Yeah, no problem.
Jason, off of one of the points that Mike just made, what happens after phase 4? Are there going to be more phases? Are we phasing into phase 4? How does this all work?
The multi-phased approach is what happens after phase 4. No, there is no phase 4 is the final phase, so to speak, at this point. That said, there are, for example, religious churches, religious ceremonies are just increased they went from 10% to 25 to 33%. I think that type of, I want to use the word phasing, but that type of growth in capacity will continue into the future on a staggered basis. And while we talked about what is open as part of phase 4, there is still very much a lot that isn't open: gyms, movie theaters, some of those things. So that is to be done at a later date, a date undetermined at this point. So, phase 4 was a starting point. It definitely isn't a finishing point, and there's more to come with that. But right now, there is no designated phase 5 or thereafter. It's really just, and the governor and the control room calls that we've been on, Amy, you've been with me on them as well. It's been stressing the slow transition. Really, the first 3 phases were low risk activities. Phase 4 is beginning to go into higher risk activities. It was really about easing back into reopening with the ability to slowly and try to maintain or minimize the spread of the disease and the virus. And that's going to be the approach moving forward. It's going to be difficult to completely eliminate it, but it's going to be minimizing the risk of and the probability of it increasing or spreading at significant rates. And that's what really the whole phased approach has been about. It's worked very successfully here in New York. We've been compliant. The localities, meaning us, counties particularly, have done a lot in terms of enforcement, trying to communicate. So it's about a slow migration back into things, and that's the approach. So I don't know about the phase 4. I concur with Mike and Jay, and probably every parent out there. K-12 is important. We have 3 young children. Obviously, having them back to school is important for a variety of reasons. And my hat's off to the superintendents and the school boards for doing a great job to date. Very difficult job, very complex. But also, I know they have great concern and want to make sure whatever program they put in place for the fall, it has the best interest of the children, of our youth, our K-12 folks, our staff, our teachers, to continue, similar to higher ed, to ensure that everyone's protected. So hopefully more to come sooner than later on what's going to happen. But that's the gist of phase 4. There's no more quote unquote phases after this.
All right, thanks, Jason. Sam, there's a question about new information are we getting on the virus itself? Things like mortality rate. Has the warm weather dissipated its contagiousness? Do we know more about how contagious it is? Is there a place that they can find that information, or do you have information on what's happening with the virus?
Yeah, important questions. I think a lot is still being studied and researched, as we've seen throughout this novel coronavirus. And so I think, and as we all know, vaccine is definitely being worked on, but progress on that is we see it in the news. I think in terms of the warm weather question is a good one, because we do see that with some viruses, the warm weather, they do decrease during warm weather, like flu, for example. But that with this virus, I mean, currently, some of the affected states that we know about are certainly quite warm right now. So it nods to the fact that perhaps the warm weather does not impact this virus as much as others.
All right, thanks, Sam. I think you're right. We're still learning so much more on this, and that's one of the challenges with a novel virus, is that it's new. So there's still so much research to be done. Flipping gears a little bit to Jason, what do you see as the best strategy to protect public health and help businesses who are relying on tourism to bring in their revenue?
Yes, this is probably the industry that is going to hit the most and the hardest due to COVID. It's also probably going to take everything we've been reading a little bit longer to recover, which is difficult. Tourism is an important part of our economy here locally. We have a lot of small businesses that rely on it. I guess the only thing we can continue to do from our perspective is continue to push out good information, be collaborative with them, those businesses, to help them find avenues to continue to provide services that in a different way, and provide opportunities in different ways than they are in the past. Part of this is reliant on attraction and interest from folks from outside our community, and that's hard right now. The air travel essentially came to a stop over some of the high points of this COVID response. Right now, there's a travel advisory. Well, a travel advisory restricting travel or requiring a 14-day quarantine after coming from certain states doesn't necessarily complement people coming in from outside the community. It's tough to endure, and I don't know what else we can do other than continue to keep our ears open. We stay in touch regularly with our folks in the tourism industry. We have a very robust way of distributing tourism funding here in the county. Our strategic tourism planning board is hugely active. We continue to stay in touch with them, continue to work with our partners, both the Chamber of Commerce as well as the Downtown Ithaca Alliance, who are very in tune to the impacts of the tourism industry. And as they bring concerns and issues forward to us, the best thing we can do is help respond to them in a way that's going to allow them to succeed and grow. Aside from that, it's unfortunate that this is one of the many industries that is having a hard time. It's going to continue to have a hard time until we get through this.
All right, thanks, Jason. On the tourism piece and the economy piece, the city recently closed Aurora Street to help bring in people to the downtown area and allow them to distance. Do you know if they took into consideration the other businesses in the downtown corridors, along with the change in the traffic pattern and how to get to those businesses? In some cases, it may have an adverse effect on those other businesses who are also trying to bring in additional customers. So do you know a little bit about the strategy behind that, or have any thoughts there?
I know a little bit about the strategy as to why, what the purpose of it was. And if you go down there, you'll notice that a lot of the tables from the restaurants, which have been really shut down up until recently, are able to have tables out on the sidewalk, which without the street being closed would create obstacles and obstructions in the sidewalk. So, being able to shut the street down was allowing those restaurants to be able to put tables outside, have distancing where they can't do it inside, and would have a really reduced capacity. So I think this is really an effort to support those restaurants on that street, allowing them to set up tables outside, provide good distancing so that they're compliant with the requirements needed to set up, allow business to resume to some level again, which it's been dormant. I mean, you have to keep in mind, restaurants have been shut down outside of takeout, if they were able to do it, for the better part of 3 months. And this is an opportunity for them to open that up. Anytime you change traffic flow, no matter whether it's city, town, village, county, wherever it is, it's going to create a disruption. I do think that a lot of businesses in the downtown area, if they're open, patrons are going to find a way to get to them, even if it means they have to find a different way to get there, whether it's a slight detour or a different parking option. So, thankfully, this didn't take a lot of parking space up because it only has limited street parking. But I do think it provides a great opportunity for those restaurants to be able to put some expanded options for service out there and try to reopen in a way that's going to give them some success. I don't know if it's going to be how long it's going to continue. I mean, that's a real city discussion. We didn't have any real discussions around that, but it was really about trying to have those restaurants have the opportunity to expand and have more capacity outside of the limitations that they've been given through the reopening process.
All right, thanks, Jason. Jay, as businesses reopen and they have public restrooms, is there any best practices or advice around cleaning bathrooms and fixtures at restaurants or other public locations?
Thanks, Amy. Yeah, this is one of my favorite questions. Having grown up working in one of Ithaca's delis, there's always something to clean when you're in a restaurant. Whenever you have downtime, you're always going to find something to clean. But right now, one thing you want to look at is taking a look at the New York State Department of Health cleaning guidelines. They'll provide great recommendations for that frequency, what type of cleaning solution. But hopefully with some of the restrictions in the number of people that you can have at one of these establishments, there's a little more free time there to do that. And it seems like every answer I give always sends you to the New York Forward website, but there's guidelines there for industry-specific cleaning guidelines that must be followed that each dining establishment attests to when they're going to open. So there's always something to clean, even in normal times, not in COVID times. There's always something to clean and make it safe in normal times.
All right, thanks, Jay. Jason, if an employer knows that a staff member has traveled from one of the designated states, is it the employer's responsibility to not allow them to come back to work?
That's a good question. I know we are trying to get clarity on this ourselves in our own organization. I think to be answered, I do know that there is leave related, both state and federal leave that's related to quarantining, so that an employer is required for those individuals to be able to quarantine or isolate related to the virus. So in that case, I know from our perspective as an employer, that is the route we are taking and evaluating further, that there is provisions in state and federal law to allow for paid leave to take place. I'm going to say that any private employer or other public employer should consult with their HR department if they have one, or with their legal counsel if they have some, to determine what's the best avenue for them and what their obligation is. I can tell you as an employer with the county, we are probably going to give guidance to our employees within the next few days on this specific issue, but it's different for each type of industry, private, public, nonprofit, and I would encourage you to consult with your industry professionals as to how this may impact you specifically.
All right. Another question about childcare. And Jay, I'll start with you, and others feel free to chime in. If you provide childcare, should you be screening families from other states? Or if a family was in one of those states, does the child need to be quarantined if the child was in one of those states for 14 days?
Yes, if one of the child went to one of those high-risk states or high infection states and they do come back, yes, and they would have to self-quarantine for those 14 days. The virus doesn't look at what age you are or who you are. It's going to affect you regardless of your age or financial condition. So those childcare providers should be screening, should be asking those questions just to be on the safe side. As to taking temperatures or things like that, it's hard when you take temperatures. You have to make sure that you're doing in a correct manner and know what those results mean. A high temperature on the first beat doesn't always mean that you have a fever. You may just run hot, you may run cold, you may have been sitting in a car. But yeah, we definitely need to make sure from people coming back from those states that they are screened and they do go into self-quarantine.
All right. And the last question I just got in was, is everyone on this call taking time off this summer and finding ways to relax outside of COVID? So I don't know who wants to take that or start that, but that's the final question I just got in.
Well, I can tell you, yes, I know our folks are. We've had some in-depth discussion about this over the past few weeks, and I've required all our staff, that particularly the ones that have been responding immediately to the COVID-19 response for the better part of 4 to 5 months, that they need to take time off this summer. They need to take some time to relax. They need to rest. They need to recover. They need to spend time with their families and their friends, with good distancing and face coverings, of course. But part of the reason Frank's not here is he's taking time off right now to be with his family. I know I am in recent weeks. Amy, Jay, Sam, we're all taking some time off. And as an employer, it's important to model that behavior as well for our staff. So I've encouraged our staff, our team, to make sure we take the time off to rest and recover and be with our families so that we can come back energized and ready to work and be able to continue to serve the community in good capacity. And I would encourage all the same, whoever's watching, whether it's public, private, nonprofit, whoever you are, it's important to take that time off, particularly now when this has been a very stressful time for people. Everybody deals with it in different ways. It's almost surreal to think what we've gone through since March, really. So, I encourage everyone to take the time that they need to relax, recover, and be able to rest up.
All right, thank you, Jason. I'm going to turn this over to Mike, and you can go ahead and close us out, Mike, with any final thoughts or comments from you.
See, now you're putting me on the spot. I want to thank everybody for holding in there, frankly. I mean, you have a great team here at the county that's done an immense amount of work over the past, 3, even 4 months. I mean, Tompkins County was way out ahead, I thought, of a lot of places. I mean, we were really looking at this. I know the health department was looking at this mid-January, really. And, you take us from there to where we are now, that's pretty great. New York obviously had more deaths, a third of the deaths of any other state. It's nice to be able to say at this point that we get a little bit of a respite, but you can't really take that respite because you know that if you don't do certain things, that it could come back. And our goal really is to return to normalcy as quickly as possible. And I want to thank everybody that's part of the county team because they've really worked very hard to get us there. And without their efforts, you wouldn't be able to get there. I mean, there are camps opening now this summer that didn't think that they were going to open. There are businesses that are open today that were concerned that they were going to have to shut their doors. And there are still some businesses that aren't going to reopen. And, if Cornell had made decisions like that, they weren't going to have students back, as some colleges already have, I don't know what our county would have done. I mean, that would be, that would have sucked the lifeblood out of a lot of businesses and a lot of people's jobs. And so the fact that Cornell is working so closely with the county and with the hospital to have those students back and then to protect the people that are here, but also protect students from other sources of infection, I think is a noble cause and something that we're looking at. So I want to thank everybody on our team for getting that done. And that's it. So. I wasn't still on mute, right?
No, you're all